neuropathy. My goodness, you gave
one
me
more
big
thing.
words. All right, Miss Cathie.
Hello, my name is Cathie, as he's already told you. I started doing research in cannabis about 2016. 2018, I'd already written up 28 medical protocols with all the terpenes and cannabinoids. And so that's what as I go, I'm going to try to explain this. And if it gets, you just raise your hand if you want me to stop. And I'll just go through and we'll work it out. Okay, I'm nervous, so just bear with me. Okay.
You're all set.
There's a lot of misinformation out there. So that's one of the reasons I started reading PubMed. PubMed is all medical articles written by doctors and physicians and all over the world. So that's where I started getting my information from. What is medical cannabis? It's marijuana or hemp. So there's medical marijuana, there's medical hemp, and it's recommended by a physician for a condition. These look alike, okay? What type of plant would you tell me these were?
Cannabis plant.
Cannabis, we got skinny leaves, so you probably think it was sativa. These could actually be like identical twins. These could have the same cannabinoids, and when I say cannabinoids, what I'm talking about is THC, CBD, CBG, CBC, CBN, THCV, and CBDV. So those are the cannabinoids. The terpenes are going to be like myrcene, pinene, linalool. So those are kind of what, and they're formed in the little flower up at the top. This is that little part. That's the trichrome. That is where the cannabinoids and the terpenes are formed. That is the medical important part of the plant. Now those leaves and the stems and all the seeds are where the flavonoids come from. And those are like Canna A and Canna B are flavonoid. They are 20 times stronger than an aspirin. So the whole plant is what we're looking at. So these could have the exact same terpenes and the exact same cannabinoids. But growing conditions such as the soil, the temperature, the lighting, that changes them. So they could actually have total different cannabinoid and terpene profiles. These are more like fraternal twins. They could have 50-50, so they could have part of the same cannabinoids and part of the same terpenes, or they could actually have the same terpenes and the same cannabinoids. That's why the chemotype, or the chemical makeup of the plant, is what you really want to find out for your condition, because the phenotype is just how they look. So if I was to look at that, I couldn't tell you if it's going to help you or not, because I can't tell by just looking at the plant. So that's why I really feel like cannabinoid and terpene profiles are very important. And so when you go to the dispensary, you want to be able to talk to the bud tender, and you want to find out. Ethan Russo is who wrote this. He's one of the, I'm actually going to see him speaking next month in Pasadena, California. It's just a better way to see one variety from another, to be able to set them apart. So why bother when you only want high THC? If that's all you want, go to the dispensary, find one that has at least 28 or 30% THC, buy it, go home, but do not expect it to do the medical because one size does not fit all. You need some tools for your toolbox. The first and most important tool is you. It's your symptoms. Because no symptoms and the cannabis doesn't affect everybody the same way. So it's very important that you know what your symptom and your illness is when you go into the dispensary. You want to be able to have the cannabinoid profile and the terpene profiles. And then you also, what are you gonna do? You're gonna smoke? Do you want edibles? Do you want tincture? Those are gonna be important things, and those are things you need to figure out and have the dispensary help you with those. And how about dosing? Are you gonna have high THC, high CBD? You're gonna have to think about, so how does it work? So I'm just gonna go through these diseases, well, arthritis first. And arthritis, it's the inflammation in your joint, and you start losing cartilage. And it happens, osteoarthritis is either an accident or you've had too many birthdays. That's how it happens, and your cartilage starts deteriorating. With autoimmune arthritis, that's going to be like rheumatoid arthritis, lupus, psoriatic arthritis. That's when your autoimmune system, your body actually fights your joints, and that's what causes the inflammation. And then there's inflammatory arthritis. That's like gout. It only affects one joint. So that's why it's so important you know which one of these you have when you're getting ready to go in to get your cannabis. And the symptoms are going to be the same. All of those are going to have the same symptoms. It's going to be inflammation and swelling. It's going to be pain, loss of motion, and you're going to have insomnia, and you're going to have loss of appetite. So what can cannabis do for that? Can it cure it? No, but it can help the symptoms. So we're going to follow the science I was talking about right ago. THC and CBD can be effective for chronic pain and inflammation according to and these are two different studies, and there's lots more out there. I just wanted y'all to know that there's medical research behind it. Older patients sometimes have trouble with mobility, and high levels of THC can make you lose your balance, and so that's not a high risk for that one. You just have to watch yourself. But now this is called a fingerprint. Okay, on a fingerprint, it's going to have the cannabinoids, and this one has, these are steep hills, so they have the cannabinoids and the terpenes. So this is THC on this side, this is CBD. So this is a more balanced blend. So if you're a novice user or you just don't really want that euphoric effect, this would be the type that you would be wanting to look for, because the THC, CBD, CBG, and CBC are very good for arthritis because they help with the inflammation, they help with the pain, and they help with insomnia. And those were three of the symptoms we just talked about a while ago. THC and CBG help with your appetite. So if you take these, they make you hungry. So we've taken care of inflammation, the pain, the hunger, and the loss. And the mobility is going to come back as the pain level goes down. And then the terpenes. All of these are included. Let me see. And actually, there's another one called Eulyptal. Okay, eucalyptus. Oh, I can't say it now. It's it's eucalyptus. Okay, I'm sorry, I've just gone blank. But it's one of the terpenes that's important with this too. These help with pain, pain and inflammation. Myrcene helps with sleep. Linalool helps with sleep. So those are ones that would help you with your insomnia. Myrcene helps with your appetite. So you're getting ready to, so you're helping with it. So all those symptoms again, you are taken care of when you get a strain similar to this or chemivore. You can do the exact same thing with high THC. Everything I just talked about a while ago, you're going to have the same effect. The CBD and THC are going to make you hungry. And with this much THC, you might not have anything in your refrigerator when you're done, because this will really make you hungry. The myrcene is going to make you sleep, and the others are going to take care of your inflammation and your pain. Okay, let me tell you one thing though. Okay, myrcene not only helps you sleep, but it's been shown in recent studies that it is repairing the cartilage damage done with osteoarthritis. And eucalyptal, I knew I'd remember it in a minute, it's been shown to help with gout. So if you have gout, eucalyptal would be one of the terpenes that you would really want to look for.
Excuse me, which ones increase the hunger?
Pardon?
Which ones increase the hunger? Increase you to eat, your appetite.
Oh, what's it? The myrcene is the one that helps your appetite. It's Myrcene. Yeah, here we are. I've got it on. Okay, so carefulline, pinene are also neuroprotective. So if you've had any nerve damage with that, it's going to help with those as well. Are y'all understanding? Okay, I just don't want to be talking because I get so excited about these things. So osteoarthritis, you're going to be wanting to use topicals. Autoimmune, you're wanting to use tinctures, but you want one with the high CBD because it works better with the autoimmune diseases. A tincture, you can take it sublingually or you can take it orally. If you do it under your tongue, you'll have immediate gratification from it, and the duration is usually about 2 to 4 hours. Now, if you take the oral and do it in different doses, it can last anywhere from 4 to 8 hours. So you got to just think about what kind of dosing you want to do and what works for you. How about PTSD? PTSD starts from a terrific trauma. It could be an accident, loss of a loved one. It could be anything like combat, physical, sexual assault, even child assault. And that can go into adulthood. One thing about it is, of all of these things that could happen, the highest percentage of PTSD patients are female, and it is from sexual and physical assaults. These are some of the symptoms. You're going to have you relive the event over and over. You're going to have nightmares. You're going to have insomnia. You're going to have severe anxiety and depression. And you're going to have trouble focusing, and you're going to have fear. Actually, it's going to turn into rage and anger. Can you cure PTSD with cancer? What's the answer? No, but it helps the symptoms. Okay. We're going to follow the science again, and it does reduce the anxiety and helps with some of the symptoms we were just talking about, especially with sleep. The THC has been shown at low doses, not high doses, to be able to help with anxiety as well. But high THC would not be good with it. You really need low doses, and you need that whole plant. Because the high dose may intensify like a panic attack or an anxiety attack. This is not your friend. Avoid pinene at all costs. If you have PTSD, never use pinene. It will induce behavior and thoughts that are not good for you. So just keep that in mind if that's your symptom. Now, instead of a fingerprint like a while ago, this is just like the terpene and cannabinoid profiles you get. It just lists what it is and what the percentage is. With this, you want to have the THC at low doses, but you want CBD, CBC, and CBG because they will help with anxiety and depression. They are very good for that. THCV will actually help with that fear and flight. It's a part of your brain that when you get that fear of that, you're going to either be angry and fight it, or you're going to be flight and you're going to avoid it. So you'll start avoiding people, you'll start avoiding certain situations because that panic that comes over you. So that THCV is good for that. Carafilline, limonene, linalool, they'll help with anxiety as well. And the myrcene will help you sleep. But just avoid pinene. Since the low doses we've already talked about, and you can smoke this, you can do the tincture, or any way that you want, but it will help with the anxiety. How about peripheral neuropathy? Now this is going to be inflammation of your nerves, so there's a little different with this. He's using that tone thing because he's seeing if you're numb, because this happens in your feet and your hands, and so sometimes you can't feel things, so that you tingle and you have intense pain. And it's actually caused from diabetic neuropathy. Peripheral neuropathy is a type of that. So it's caused by increase in your blood sugar level. Symptoms are going to be, like I said, it's going to feel like somebody's stabbing you, tingling, numbness, all those things are going to be in your feet and your hands. And can it cure it? No, but it can help with the symptoms. It's been proven with the inflammation and the pain, and you'll also have muscle spasms. That is part of the peripheral neuropathy. And high doses of THC may cause panic and anxiety in some people, so you might want to think about this too. So this is another one of those fingerprints, and what happens is you want a more balanced blend with this one. The CBD and CBG will help with your anxiety and your depression. THCV is actually really good because it helps with that fight and flight thing I just talked about. No, I'm sorry. This is I went back to PTSD. THC with this and CBD lower your blood sugar levels. And just a few minutes ago I said that peripheral neuropathy was caused from increased blood sugar levels. So it's been, there have studies that say that THCV and CBD will help lower your blood sugar levels, which is really good. That's because that's where you want to go to be able to recover. The carafilline, the humulene, myrcene, and limonene, those are all help with the inflammation, help with the pain, and they help with insomnia, and they also help with muscle spasms. And now the terpenoline is another one. It's a little different. It doesn't help with inflammation or pain, but it's very sedative. So it would also help with the insomnia in your sleep. So we're going to talk about dosing again. You can do the sublingual drops, or you could do the smoking, and it does reduce the pain and improves mood. And just keep in mind that high levels of THC are not good with peripheral neuropathy. Let's talk about glaucoma. Now, this is where the pressure of inside your eyeball, it increases. And as it increases, it puts pressure back on your optic nerve. And that's what causes the pain and it starts affecting your sight. So you'll eventually lose your complete sight. Now, I do not want you to stop taking your prescribed medications with glaucoma, because they do provide you 24-hour relief, and you've got to have it. You need to keep your intraocular pressure between 12 and 22, and if it starts decreasing, it's just as bad as it starts increasing. THC will lower it, but only for short times. So the problem is you would have to be smoking or taking it all day to be able to have that 24 hours. And it's just not something I think that is a viable service. So if you have glaucoma, make sure that you get a chemivore, a strain that does not have CBD. CBD is not good. It will increase your intraocular pressure. At 20 milligrams, it'll negate the THC, and at 40 milligrams, it will start increasing it by 18%. So you do not want to use CBD with glaucoma. It's not your friend. Okay, let's talk about dosing. We've kind of been talking about it anyway. So there's 3 types. Type 1 is going to be low CBD, high THC, and it's going to be 5%. Well, if we do a 1-to-20 ratio, that would make it, so if you walk in and they ask you what ratio you want, 1-to-20 is going to be 5% of the CBD, and it's going to be 95% of the THC. Now, if type 2 is going to be a balanced, so you're going to have the same amount of THC as you do the CBD, and it's going to make you're not going to get the euphoric that you do with the type 1 with the high THC. Type 3 is going to be high CBD and low THC. So this would be 20-to-1 ratio. So you would have 95% of CBD and 5% THC. It's just not a cookie cutter way. It's hard to get it right. So what you want to do is, this is going to be your job. You're wanting to shoot for your sweet spot. That's going to be where that dose, you might start out with a real low, start low and go slow. So start at like maybe 2.5 milligrams if you're doing a tincture, and then work yourself up to where you can get the dose that's best for you. And then also, you want it to have the least side effects, and then you want the optimal outcome for your treatment. Dosing matters. So if you want to repeat those same cannabinoids and same terpenes so that you can keep it consistent. It's just like any other medicine. And when you go, when you're working on your symptom, I go to the pharmacy and my pharmacist has never asked me, how do you want to feel? He says, what is your symptom? Or he fills my prescription from the doctor. We want to treat this as a medicine, because it is a medicine. The problem is, it's just, let's take the pieces of the puzzle. So take which CBD or THC you need, which terpene you need and put them together, and then you can go from there for where you're going to go for your treatment. Be realistic. It's not a miracle, it's not a miracle cure, but it does help the symptoms, and it certainly can improve your quality of life. And motivated and educated patients do much better with their treatment when you're involved. So you really need to be involved and be a team member. Strains, no gain. Profiles, worthwhile. That's just my thoughts on that. Well, what should you know about cannabis? Well, there's a few things we'll talk about. It has labels just like any other medication, and this is an Arkansas label. It's not to be used by pregnant women or breastfeeding. Keep out of reach of children, and then do not operate machinery. The police talked about that with us yesterday. But these are some conditions like, not so common, used by qualified patients only, and this product is not approved by the FDA. This is the disclaimer, but this is also their labeling. What about edibles? Anybody thinking about edibles? Life is like a box of chocolate-infused cannabis. You never know what you're going to get. So when you're dosing and you're going to do edibles, you need to start at a low dose and work your way up. Because when you're smoking, THC is delta 9. But when you eat it, it goes into your liver, it becomes delta 11, which is hydroxy THC, 4 times stronger than THC, the delta 9. So keep that in mind. That's why edibles, sometimes you get more effects than you want to. It's because that THC is a lot stronger once the liver, the enzymes in your liver are what cause that to change. And as Willie Nelson would say, it won't kill you unless a bale of it falls on you. So you're not going to die from THC or cannabis. But it may have some side effects that you may not. You can be paranoid, you can start getting hallucinations, you get really anxiety attacks, nausea. And those are real. And children, you keep it out of reach because it can be toxic to children. It causes respiratory distress. So when they say that label, keep out of the way for children, please do that. Some tools for your toolbox. So how about you have that panic? You're panicked and everything's going on. Well, I was telling you about that lemon or lime juice. You have that at home. That is limeine. That is the terpene I was talking about a while ago. It's a mood stabilizer. It'll help you calm down. It'll help you be able to help your anxiety. Pine nuts, that's pinene. You can chew on pinene because pinene will counteract part of the effects of the high THC. Drink plenty of water and sports drinks. That's so you can stay hydrated. That's another part of being able to get down from your non-wanted effects. Calm breathing, CBD, our black peppercorns, that's carefulline. That's going to help your calming and anxiety as well. So, do you have any other medications you're taking? This is really what Brian should be up here talking about, but anyway. Blood thinners for sure. If you're taking Coumadin or warfarin, cannabis can increase that. So be careful about your medications. I want you to write down anything at all. It's this right here. www.drugs.com/interactions. When you go on there, you put on cannabis as the first drug, and then you take that and add all of your medications you're taking. And if you're going to have any moderate or type of reactions, it's going to show up on that website. So that is a great website for you to use. Also with your heart, if you already have AFib and tachycardia, you may want to think about doing if you start having adverse effects, you don't need to do THC. And this is not everybody, but if you have heart conditions, you just need to be aware of because it will increase your heart rate. Now this is another one that's rare. It causes strokes. It's called Reversible Vasoconstrictive syndrome. And what happens is these thunderclap headaches, it feels like that you have lightning hitting the top of your head, and it's very intense and it's very hard. If you have these, it's caused from cocaine or high levels of THC. So it's rare, but if you ever have a really type of headache, go to the emergency room so that they can do a scan and check. Or if you have trouble talking or trouble walking, get to the hospital. Also, if you are bipolar or schizophrenic, you may want to not use high THC because it can intensify some of your symptoms. So you may want to use 2 parts, if you want to smoke, use 2 parts of CBD flower, 2 parts CBG flower, and 1 part of THC flower. So you can get some of the effect, but you're going to have 4 parts to 1. You're going to have 4 to 1 ratio, pulling that down. How about babies? Well, THC has shown to cause low birth rate, and when you're breastfeeding, 2.5% of whatever urine is going to your baby from you. As with any other medication, you need to make sure that it should be used in addition to your regular medication unless your doctor tells you elsewise. So for your final thoughts, be realistic, motivated. Remember that I'm repeating it again because motivated and educated patients do much better with the outcome of what their disease is. And another Willie Nelson saying is, the biggest killer on the planet is stress, and I still think the best medicine is and always has been cannabis. And I agree with that. So, is there any questions? Does anybody have any questions they want to ask me? Yes. And okay, she was wanting to know if the peripheral neuropathy had come from like chemicals induced rather than from the bones, yeah, from sugar level. So yes, it would work the same way. Any other questions?
What if I go to a dispensary but I can't find that for a particular strain?
Okay, that's a good question. What happens if you go to the dispensary and you can't find the strain you need? Well, you may need to be doing a little mixing and matching. So you may need to take one tincture if it has the terpenes in cannabinoids you want, but it doesn't have one, you may be able to blend these together and do a regimen to help you get through your treatment, to get what you want. Yes? Okay, that's gonna be Brian Nichol right there. Brian?
Yes, Cathie.
Okay, restless leg syndrome neuropathy. Could we use the same prototype or not?
Well, as far as usually for a restless leg, that's hard to get a hold of, as everybody knows it is. Usually you're looking at a combination of CBD and CBG, as for most things that we're treating, to try to get a hold of that. It still can be difficult. Usually I recommend using both of those at night, oral tinctures, starting off, like Cathie mentioned, about 2.5 to 5 milligram dose of THC is a good starting point, with about 16 to 32 milligrams of CBD. A lot of times I'll help patients rest through the night, not wake up from their restless leg syndrome symptoms. Another cannabinoid I'm just trying to play around with for the patients I have, so if you want to be a lab buddy, let me know.
Take the mic.
Okay. I'm sorry. Sorry, I'm going to sneak by.
Ryan, check yourself, man.
That's all I got, guys.
Come here,
That's all I
man.
got.
Huh?
Casey's got the pipes for this, not me, that's for sure. But restless leg syndrome, everybody who suffers from it knows what a difficult thing it would be to treat. Typically, I will recommend patients start off using a combination of THC and CBD, like Cathie mentioned. Usually around, I'm a big tincture guy because of the reliable absorption. I'd suggest around 2.5 milligrams of a THC tincture used with a full spectrum, that means a whole plant extract of CBD at around 16 milligrams. Start off using that at night. For most of the patients, they seem to get some symptom improvement. Patients that are having even more difficulty, I am starting to play around a little bit with another cannabinoid called CBN. We'll be talking a little bit about that later.
On CBN, if you, let me see, it's 25 milligrams of CBN is equal to a 10 milligram Valium. So just think about that. That's pretty intense.
Yeah, it can help a lot with insomnia, and that's the primary purpose that I'm using it for. But as I've been using it for insomnia in some of my patients, I'm getting a feel to see how it works for restless leg syndrome. It might be something to consider. If anybody wants to talk to me about trying that, I'll give you some advice on that individually if you want.
All right, any other questions? Yes. Yes, you can get THC topical. When you go in, it's going to be on there, there'll be a ratio. If you're having really intense pain, and nerve pain and bone pain both are pretty intense pain. In cancer pain, you'll probably you're going to want to get, is it 30 to 1, 20 to 1? I would really get a higher THC to CBD level to get down to the pain with topicals. Any other? Okay, well, thanks for coming.
All right, thank you, Miss Cathie. Thank you, Miss Cathie. That was wonderful. I think one of the biggest takeaways for you medical cannabis patients, for both what Dr. Nichol and Miss Cathie are going to talk about today, is it's not always just about the potency percentage, right? Common misconception whenever you're in your dispensaries, whenever you're talking to bud tenders, is I want the most potent thing out there. What you'll actually find is there are a lot more medicinal applications to these more well-rounded cannabinoid profiles, including all of these high terpene profiles in each individual dose. So guys, what we're gonna do is our next speaker, Mr. Brandon Thornton, the president and CEO of Steep Hill Labs here in Little Rock. He will be on in about 15 minutes. So we're gonna break for the time being. If you need to go to the restrooms, they're right out those two doors and straight ahead of you.